It's official. Medicare New Handbook has just been released, the 2025 version. I'm going to go through and highlight the one that I think is going to affect the most people on Medicare. So let's get into it. Okay, now if you've ever seen this book, most of the times it comes in the mail. Sometimes it's electronically delivered, but it's yay big. It's not the most interesting. So what I did is I created a Medicare 101 webinar. It's in the link below. It's absolutely free to attend. It plays every week. So if you're looking at that book and you're like, is there like cliff notes somewhere or like quote unquote like Medicare for dummies, like those intro books that just give you the information you need to know to make a good decision and kind of nothing else. You don't want to be an expert in it. That's what the webinar is for. So do click the link below and you won't be let down. All right. So here is the beloved manual for us Medicare agents. Obviously, there's no Bible other than the Bible, but when it comes to details and us referring to something, we're actually looking at this book, and you guys have this book. So don't just use it to level your coffee table. Don't look at it and kind of throw it to the side. You should thumb through at least the first page, second page. What's new and important. This is where we're going to hang out because this was a big one this year. So when they announced that this year, I made a video on it. It's somewhere on my channel. But lowering your prescription drug costs. So, because of President Biden's new prescription drug law in 2025, your yearly out of pocket drug costs will be capped at $2,000. This is very important because it will help some and it won't help others. This is what I mean. If you are someone who maybe takes Eliquis, or if you've heard of people, the infamous donut hole. The donut hole will not exist in 2025. Now, what it's basically saying is coming out of your pocket is capped at $2,000. So if you've heard of people saying, all of a sudden my Eliquis was $47 a month and then it jumped to like, I don't know, 300, $400. What happened? This is also going to help those of you who are on things like Ozempic, Mounjaro, those GLP-1ers, all the variations of them these days that are coming out. So those that are tier 3 and above. So let's go through that just quickly. Tiers, the formularies of these drug plans, whether it be a standalone drug plan or a Medicare Advantage plan, have these formularies. And basically what it is, if a formulary is broken up into, depending on the company, 5 to 6 parts. And think of the formulary being comprised of lists. So when you hear of my lisinopril is generic, it's a tier 1 medication. What people are talking about is that because it's a generic drug, it's found on list number 1, which is going to be your most common. So like your generics. And so imagine out in front of you 5 to 6 different papers with lists of drugs on those papers. That is the company's formulary. Now, Eliquis, let's take for example, is usually on tier 3, tier 4, tier 5. So per company, Eliquis may sit on a different tier, on a different list. So when you do your annual reviews this year, which if you're not doing an annual review this year, you need to make sure and do an annual review this year. This year, more than any other year, because of this change, you want to make sure you're on the right plan. So October 15th through December 7th, that's your annual enrollment period to where you can make changes. No matter if you're a Medicare supplement, no matter if you're a Medicare Advantage, the both of you have drug plans. One's just standalone, one's baked into the Medicare Advantage plan. You do need to review that if you're on medication, or if you are if you are not on medication. Here's why. Is because of this is where I said it's going to help some people, it's not going to help others. So the people that it's not going to help are the ones that are enrolled in a drug plan because they got to, because you get penalized if you don't. However, you just take a lisinopril, and what you could pay cash for lisinopril is less than your drug plan premium. You're going to see a lot of that in 2025. I know I'm going to get calls from people that are saying, "What? My drug plan went up 20 bucks. I only take a statin or a blood pressure pill. Um, is there any other plan?" And that's exactly why you need to work with somebody, or you need to do your due diligence if you're looking at not paying extra insurance premiums for something you don't need. Okay, that's my disclaimer. I personally am obviously telling you to work with an agent. In the very beginning of the video, I said you kind of want to know what you're doing, but you don't want to be an expert in it. So we are the experts. Find one in your area. If you cannot find one and you are looking for one, there's a link down below how to get in touch with me. So let's continue. Jumping back in here, you see where it says go to page 83? You can actually click. This is a clickable document when you download it from Medicare.gov. So do so. Very helpful. So when you click, takes you to page 83 where it's going to go in depth on the drug plan program. I do want to review this part. The Medicare prescription, it's a mouthful, Medicare prescription payment plan. So this is an actual plan that is serviced starting in 2025. This new payment option works with your current drug coverage. Basically, this is saying that the insurance company who is servicing your plan, it's working with your coverage. So you're working with the insurance company to help you manage your out-of-pocket drug costs by spending them across the calendar year, January to December. Very important, people. Listen up. This payment option might help you manage your expenses. However, but it doesn't save you money on money or lower your drug costs. So what does this mean? This means that if you are on those higher lists, those higher tier, the specialty, the brand name medication, you know who you are because you're probably paying more than you wish you were this year. So next year, this is going to help you. However, it's not going to decrease the amount you pay for your Eliquis or your Ozempic. It will just spread it out on a payment plan. Remember the good old days of layaway? Only this time you're going to get your medication, not, slowly pay it off. So if buy your prescription and the pharmacy fills it, and they see that you qualify, and that you're going to hit your out of pocket based on your prescriptions that you've filled, then what they're going to do is spread it out over 12 months. And yes, this is going to help a lot of people. But the main message here is things are changing. You're going to get an annual notice of change. It's called an ANOC. You're going to get an annual notice of change probably in the next couple of weeks, into September, beginning of October. You must look through that. You also must look through in this Medicare and You handbook. They actually, like, if how you could tab um, documents back in the day, you used to have those little sticky notes and tag them. They did that and it says new. So you can literally control find in that document and new, and you can learn everything and pretty dang quick, skimming through it, and probably in about 15 minutes. That's coming up in 2025. Maybe it affects you, maybe it doesn't, but at least you're informed. So two things: your Medicare and You handbook and your annual notice of change. Review those things hopefully before October 15th, kind of a busy season, to December 7th. Last thing I'll leave you with is if you're on a Medicare supplement and you are looking at your plan, and the last rate increase usually doing between June to September, the last one you're just not happy with, do not wait till October 15th. You can shop your Medicare supplement plan any time of the year. Actually, I know a lot of people think I got to wait till enrollment period. Not for a Medicare supplement. As long as you can answer a handful of questions, no, meaning yes, they will ask you medical questions. As long as you can answer them no, you're free to shop. So shop around because remember a plan G with Aetna, with a plan G with United Healthcare, and a plan G with Mutual of Omaha, they contractually have to cover the same thing. They're picking up whatever Medicare does not cover. That's the beauty of a Medicare supplement. So, um, review those and shop your plan this year. I'm all for not overpaying for something that you don't need or for something where you can go down the road and get it for the exact same plan, but for less money. I'll see you in the next video.